Herkese merhaba. Welcome everyone. Today it's a quite unique day for me because after the summer break and all the broadcasting we made last year, because of the corona, we started these interviews and make it possible to reach out all the digital technologies to everyone, how it can be implemented in our clinical workflow, and what are the new things about digital technology, because digital is not now the future of dentistry, it's today. We can talk about it very easily, that these technologies can be done pretty easily in our clinical workflow and implemented for our patients to help them for a better patient care, and they're really satisfied with all the results. Of course, the R&D, research and development, is going on this area. And today I have a guest, special guest, which he is, I think, the company is as well. I think one of the most futurist companies in dental world. So I would like to first welcome him and invite him in the show so I can introduce him better and we can talk about it, his story firstly, and then the FirstFit system. Welcome, Carlos.
Thank you, Dr. Sina. Thank you for inviting me. Okay, I'm glad to be here. I think I will blow up some great minds on dentistry with this technology.
Perfect. I would like to just give brief information about you firstly, because you graduated from Venezuela as a dentist and then worked there as for 10 years. Then you switched your whole life to another country, which is actually not really quite strange for you, because Spain is like probably you kind of feel familiar with your culture and everything. But how you started to work from then to switch all this, made this decision, and then how you feel to work in such a different field than what you have been doing before?
I feel very well. This country is very familiar to Venezuela. Okay, it's the same language. Is a close culture. Okay. Well, I'm a dentist from Venezuela. I was working as a professor at the Central University of Venezuela, and now I'm here in Spain. So maybe because I was working a lot with digital dentistry. Now I'm here in FirstFit technology. Okay, so now this is my home, and I'm very exciting to work with this new technology. You know that.
Did the company find you, or you did found them?
Yeah, the company find me. Yeah.
And can you explain why you?
Yeah, the company found. I don't know. I think because my CV, okay, and all my research about digital dentistry in Venezuela, I was working with all the CBCT technology, okay, around 3D and digital image technologies. And I was working as a professor, so maybe that was the reason for I'm here now.
Right now, the artificial intelligence is going more and more in radiology field. I mean, all the future is changing. I mean, today is changing and future is changing for dentistry. I mean, all the applications and everything will change. Can you tell us more about the FirstFit? Like, actually, sure. not really sharing your presentation firstly, but how the company just came up with the idea, who are behind the technology, and how is the company workflow is going on right now?
Well, I think this technology comes from Belgium. Okay, from some kind of guide. That kind of guide was maybe a Windows. Okay, so you saw all the tooth, okay, inside the window, so you can prep all the excess of the tooth. Okay, but this company um, develop sorry man, develop a new technology, okay, with all a digital process and CAD/CAM software, okay, to improve all the preparations, okay. So you will see in my presentation all the benefits about it.
Perfect. One last question before your presentation, actually. So, do you feel like all the applications will change when the system is completely done?
Yeah, yeah.
No more impressions, maybe.
Yeah, I feel that maybe this kind of technologies will change our profession, okay, will change dentistry as maybe Invisalign does, okay, or maybe the implants guide surgery does, okay. So I think now digital dentistry is the present, okay. I think will come more and more kind of digital technologies to work with I think very predictable new techniques. You know that.
And this is actually my third guest from Madrid. You are my third guest from Madrid, and digital technology is really interested in Spain, I think, because Christian Kochman made the DST center in Madrid. And I had Dr. Cuadrado from Madrid as well. He's a great clinician working with digital technologies. How you combine the thing that the affiliation of the Spanish people or the Spanish country that is working a lot with the digital technologies, mostly maybe in Europe?
Yeah, I think here in Spain, all the technologies about digital dentistry will increase, okay, in all Europe, okay. Actually, my wife works in digital smile design, so yeah, I know Francis Coachman and Christian Coachman, and yeah, I think we are working very hard to improve these kind of technologies to get in all the countries in Europe, okay, and also in Latin America and all worldwide. You know that
Spain is kind of a center combining both continents very easily. So
maybe Spain is the center. Yeah.
Yeah. I would like to share your screen and give your presentation, and we will talk during this your presentation as well. But I made some questions for you as well. But we will just talk about it when you are doing your presentation.
Well, here are for rethink preparations. When we talk about veneers, man, we know that we have a lot of research about it. Calamia was already speaking in 2007 about the 25 reasons of success on veneers treatment. And maybe we need to know that when we do veneers, we need to get a balance between the materials, the substrate, the thickness, and the relationship between the translucency and the opacity of the materials. Obviously, the key to success is how much do we prep. We know that we need to work always over the enamel, okay, and try to avoid the denting because all the adhesion factors. So maybe the most important factors when we do veneers is the prep control. There are maybe 3 generations or classification for veneers prep. One of those is prep guide by calibrated boards, using this kind of boards to make marks on the tooth. Okay. The second one is the silicone index guide prep, using the silicone guide to see how much we need to reduce. But when you see this kind of conventional workflow, always we need to use a periodontal probe to measure that, okay? And in all the Congress, we always talk about the minimal dentistry, okay, in microns, but when we see this, we just see a periodontal probe in millimeters. So we need to change that. The other classification is the aesthetic prevalutive temporaries of Dr. Galit Gurel, using the temporaries to get all the balance between the veneers and the preparation. So what is FirstFit? FirstFit is the first generation of prep control. It's a digital control veneers prep technology that allows us to get a real thickness in microns between the veneers and the preparations. Okay, this technology uses all the benefits and advantage of CAD/CAM patented software to control how much we have to achieve on a veneers case. Also, digital plan allows us to prep the digital model, the STL, okay, and allows us to build, okay, this kind of prep box, okay, and to print a prep guide. So you will receive these prep guides to put into your patients, and use this kind of special handpiece with a different head, okay, with a disc. I think that the handpiece and the guide make a fit, a very great fit between these two parts of the technology of the systems. Okay, so you just need to do the preparations. All these preparations have been planned on a digital software, and then you can cement all the veneers in a position tray. So if you want to do a case with FirstFit, you just will need photo protocols, okay, extraoral photos, then intraoral photos. Then you will need an impression or maybe intraoral scans. Doesn't matter if you prefer impressions or scans, it's the same for us. And with all this information, we can do the digital plan, okay, align the 3D model with the photos, and plan all the aesthetics with the patient, okay. After that, we always recommend a biofunctional mockup. Okay, so we will print the design, and you can mouth patient. After your approval of this design, we can plan the digital preps. Okay, so we superimpose the approval design, okay, veneers design, with the work model, and then we can plan all the preparations, trying to get a great balance between the restorations and the teeth, and then the software allows us to get the prep boxes and printed. Also, the software, with the software we can do some real measurements. Okay, here in the video you can see 0.47 millimeters, just 400 microns of thickness of this preparation. So it's a very lovely technique. In some cases we can do minimal balance, around 0.4 millimeters or 400 microns. Always we try to get a group balance with the thickness, because we need to think in the relationship between the opacity and the translucency with this new restoration, as IMAX does. is a monolithic ceramic, so we need to get a great balance, so we can evaluate that with the software, with a full contour between the veneer and the tooth. So we can design and build the final restorations before prep the patient. Then the software can build all these STL guides. Okay. As you can see here, all the prep boxes following all the preparations over the teeth. So then we print the STL guides, and you will receive this special box with all the prep guides, okay, with a number and a letter. The letter is the type of the board that we design in each case, okay, and you will do the guide prep following the prep box using this patented handpiece, and you will prep like that. This is a real minimal guide preparation, you know. You can see this image, doctor?
Yeah, we are
okay
with it. I'm just listening.
Okay, no, don't worry. So, as you can see here in this photo, this is a real minimal guide preparation, okay? It's just in microns, okay? So the accuracy and veracity of our technologies is around 50 microns, okay, of margin of error. And then you can do the cementation with a positioning tray. You can use this positioning tray to do all the conditioning systems with the porcelain edge and the silane. We always recommend to plan the cementation with light cure cement, okay? Because you will need time to clean all the excess with brushes, and then use this special tip of the lamp, okay, to do some light in the middle of the veneer, and then you can keep the position tray and clean all the excess with saw and floss, and the results is very beautiful in just minutes. Okay, this is the same patient. This is a patient of our courses. We always do courses and plan courses with live patients to show the benefits of our technologies, and this is a macro photo of the fitting of the restorations. So if we think and compare about the conventional workflow, you will need maybe 4 or 5 different appointments between the photos, the videos, impressions, then a motivational mock-up, you know, that all additive contour mock-up.
Yeah.
Then you will need to do a hard appointment with preparations, impressions, and the more headache thing in dentistry that this is the veneers temporaris.
Yeah.
And then you will need to do another appointment with the placement and cementation. I think maybe all the morning or all the afternoon, 4 or 5 hours to do this kind of workflow. With FirstFit, you just need the first appointment with photos, videos, and impressions, and then you will decide if you want a digital mock-up or you will do a biofunctional mock-up with your patient, and then you will do the guide prep and cementation in just 90 minutes, okay? So you need to forget these hard appointments and need to forget the problems with the temporaries, okay? So it's converting maybe a conventional workflow of 10 hours in just 90 minutes, okay? 1.5 hours. So it's a very predictable technology. It's a very faster system. It's simple and precise, okay? So in summary, you can prep and cement in just one appointment. You won't need temporaries, no skills required. So we have a lot of orthodontics dentists and periodontics dentists doing veneers cases. So we can amplify the market. We are talking about a treatment that is very expensive on dentistry in just 90 minutes. You can do 4 cases per day. So here in Spain, we have a couple of doctors that they did 4 cases per day with our technology. The time of production of our lab is around 2 or 3 weeks. The costs are minimal and more benefits. Okay, it's a guaranteed success of on veneer treatments. Okay, we are working with a lot of research. This is a special issue of Digital Dentistry, of a Journal of Aesthetics and Restorative Dentistry, and I'm glad to show you this research of Dr. Bruno Pereira da Silva and Dr. Kylie Stanley and Dr. Jamil Gardi talking about FirstFit as a way to do a veneers treatment with digital technologies. This is before and after of the treatment of this patient. This is another patient of our courses, okay, before and after. Okay, this is a great case from Dr. Bruno Pereira. I think this is the case for the research. Okay, this is Claudia. This is another one, and all of this is in just 90 minutes. It's crazy to think. So in all the cases, we need to show in our courses all these benefits, trying to do a complete case of veneers in just 90 minutes. Okay, this is before and after, upper and then lower case in 2 different courses. This guy works in a special company. I think is this company of I don't remember now, but it's
yeah, it's okay.
It's a special company that makes smiles, very big smiles on our persons. You know that?
Yeah.
Well,
perfect.
It's a short presentation because
it's great. I mean, thank you for your presentation. I mean, I got many questions actually, but these questions are not really for myself actually, because I can already we already made our speech conversation about the technology itself, and we just shared about the workflow very precisely, like what's going on inside the business. So firstly, let's talk about the software. The software is not, I mean, to make it clear for all the audience itself, there is another software you are using it to make all the preps and all the calculations and make the guides ready. This is not some ExoCAD or TreeShape or whatever system it is. So
no, this is our software. Okay, we develop this software. We develop and patent this software. Okay, so we can work with design. Okay, with ExoCAD, but when we think about digital preparations, we need to use just this patented software.
On this software, I mean, you are able to do the preps for the laminates as well, but maybe for other applications itself, is it possible to do some maybe a root canal treatment guide or another guide for resection, apical resection, or something else? So, do you plan in such cases when you want to develop the software? What are your goals in short term and long term?
Yeah, in some cases we can plan with other software as Exocad or maybe other software as 3Shape, other kind of guides for gingivectomy or maybe crown lengthening or maybe when we need to do a bite lift, okay? But with our software, we just can plan preparations. Actually, now we are working to develop a new system for prep crowns and prep tabletops, and try to get all the benefits of this kind of restorations, also bridges, and also bone lace. That is the veneer with the tabletop, or veneer with the occlusal overlay. Okay. Yeah. But in this moment, we are just working with the veneers cases. Okay. I think maybe next year we can work with another kind of restorations of crowns or something like that. You know.
So. Well, I mean, any case can be done for laminates. I'm talking about, of course. Any case can be done with this technology, or do you feel any contraindication for this kind of case selection?
Okay. This is a good question. You will need to know that FirstFit did not invent the veneers. Okay, so the indications are the same. If we think in a conventional workflow, okay, we just developed a new technology to get all the digital preparation with this special software. So the indications and the contraindications are the same, okay. So and the limitations are the same. Okay?
Yeah. So. What kind of complications did you face during this progress of making cases and everything? Like, is there any problem happening when you are facing, when you plan everything, did the guides and everything, and then some other complications can occur, of course, like for the guided implantology, when we talk about, I mean, it looks like great, but somehow there are some deviations and some other sort of things, which is the maybe mucosal support and the resilience is different. So the guide can move a bit. So in your case, I mean, in this workflow, what can be the main problems for the complications for the doctors who would like to use this system?
Yeah. When you send us the final impression or intraoral scans, you cannot change your patients. So you cannot do a restoration, a new restoration, because we always plan the guide with this work model. Okay, so if you change anything, actually, if you change microns, maybe the guide will not adapt or fit in your mouth. So we need to care about for all the orthodontics patients, you know that, okay, and we need to care about of all the patients with periodontics problems. Okay, we need to care about, and maybe you need to avoid change, okay, anything in the mouth. I think this is the little thing with our technology. Okay.
Do you think is it possible to combine your prep guide system with implant guide systems. In case of maybe, I'm giving an example, maybe a central is lost, so we will have to extract this and then place the implant, immediate load it, and during this whole process we can do the veneers at the same time, at the same appointment. So then we will finalize the implant restorations maybe 3 months later, but at the moment we will have everything ready. So do you think this is possible, or what do you think about it?
I think this is a great comment, because maybe in the near future we can plan a hard case, okay, with different restorations, okay, as veneers, implants, crowns, and bridges. In this moment, we can work with a complete case, but you will need to do the conventional preparation of your crowns or your bridges, okay? So we can build the final restorations of the veneers and the crowns, okay? And you will cement all together, but maybe in the near future we can add, okay, the implant planifications in the software. This is a great comment. I need to talk with my R&D department to talk about it, because I think we don't.
You really didn't talk about it that much.
This is a new idea from you.
I mean, like in my case, I'm a prosthodontist. I mean, I'm working with mostly full cases. So that's why what I would like to see and what I would like to receive from your side as the technology side. I mean, the company side, not because, I mean, especially your side as well. That something gives me that everything in one piece at the same time. If I have implants and laminates at the same time, maybe it's like complete result of everything in one session, which is possible, I think.
Yeah, I think it's possible. I want to share
Sure.
another thing with you.
Sure.
Let me share my screen again, okay?
Sure.
Let me check here I think here.
Because when you make this all preparations ready and make all the design for the final restorations, then bring it this model which you did the prep to the exoplan or whatever the guide system can be designed. You can extract one of the teeth and make the guide there and make the restoration there as well. I mean, which is quite possible, I think.
Yeah, I think it's possible, okay?
I mean, it's just an idea which I came up right now.
Do you see my screen now?
Yes.
Okay, so this is a patient from our courses. Maybe, I don't know why, but let me check again. Okay. Oh, this doesn't work. Oh God, pretty bad.
That's
I don't know why, but maybe it's the platform. Let me try again.
Yeah, sure, no problem. We have time.
Yeah. I think. Okay. No, this doesn't work in this moment. I don't know why. Maybe it's the platform, but
It's okay.
Okay. Well, this doesn't work.
Yeah, that's okay. Sometimes technology is not really working very well. Sometimes.
But in this case, we plan a lot of things. Okay, with the exocad and our software. Okay, we plan all the veneers, the design. We plan crown lengthening. We build a crown lengthening guide. Okay, with the same software. Okay, then we plan a bite lift. Okay, and we plan lower restorations over the premolars and the molars, okay, to get this bite lift, and then we do the veneers, and the case was excellent, man. The results are beautiful. You know that?
Yeah. Do you
the same? Yeah. Let me know.
Do you get any resistance from the doctors which are more experienced on this field of laminates workflow? I mean, of course, I'm a young dentist who is passionate about digital technologies and everything. That's why I'm interested for it. But if a doctor which is like maybe 40 years old, 45, at top of his skills, he doesn't need his things.
Yeah.
How you try to convince him?
I think it's the same that we saw with Invisalign, you know, in the orthodontic world on dentistry. Okay, all the orthodontics doctors said that, I think 15 years ago or 20 years ago, Invisalign doesn't work. This is not a real orthodontics treatment, you know that. So in some cases we saw the same thing here with aesthetics doctors, okay, but in all the cases we do our courses with live patients, and maybe when they see the patient there in the course, you know that, with a live course, and they see a complete case of veneers in just 90 minutes, they say, okay, this really worked. maybe I need to try one case. Okay, I think this is the same with Invisalign, because in this moment Invisalign works with different doctors, yeah, but all the orthodontics doctors can plan orthodontics treatment with other kind of techniques, okay, as conventional braces, lingual braces, you know that. So you can work with different techniques. With FirstFit is the same, okay. In some cases, maybe you will need to do a conventional case, okay. In some cases, maybe you will need to do an additive technique, okay. And in some cases, maybe you will need to do a FirstFit case. Yeah. So it's another option in our profession. Yeah. You know that?
Definitely. I mean, I totally agree with you that. But yeah, when we come back to the workflow, do you prefer digital impressions or conventional?
Okay, this is a good question. It depending of the hand, okay.
Or the device as well.
What?
Or the intraoral scanner as well.
Yeah, it's the same, okay. It depending of the hand, okay, because in some cases we receive a perfect conventional impressions, you know that, and in other times I receive very worse impressions, okay, and in other cases with other doctors we receive a perfect intraoral scans, okay, and in other time I receive maybe worse intraoral scans. We can work with these two technologies. It's the same if you take a good impression and if you take a good intraoral scan. Actually, we did a course in Miami, Florida, in United States, past year, and we plan all the case here in Madrid, okay, and all the case comes from United States with intraoral scans, and in that moment we compared, okay, that kind of workflow, because in that case we need to do a full arch intraoral scans, so we know all the research about the issues and the problems with full arch intraoral scans. But in our case, if you do a good intraoral impression with a new technology, new intraoral scans, we don't see problems at all. Okay.
Perfect.
Maybe if you work with an old intraoral scan, 5 years ago intraoral scan, maybe you will find some problems. But in this moment, I think it's the same if you take a good impression or a good intraoral scan.
Perfect. The thing is about that the printers are also quite important here. Your protocol is based on very high accuracy with the printers, and it's the design is completely can be processed with intraorally as well. So how you decide which printer, and how did you decide actually which printer you will use and why you are using it?
Yeah, we have an R&D department that works between Belgium, Spain, United States, and Costa Rica. All the team of R&D has been working of all this kind of process, okay, with different printers, different mill machines. In this moment, we use a printer of 3D systems, okay. It's an industrial printer, okay, with a very high accuracy of the result. It's not the same if you think in a dentistry printer, okay. If you think in a dentistry printer, you will get a very small printer, okay, maybe $3,000 of cost. But these other industrial printers is around I think $100,000. Okay, it's a lot of money, but the difference is in the results. Okay.
Yeah. So your prep protocol is based on kind of vertically preparation. So you are not really going for the horizontal prep because of the technology itself. But how the feedback is coming from the doctors about this technology, about this workflow?
I think this is a great technique, okay, to work with new materials, okay. You know that in other years, I think 20 years ago, always we need to prep an horizontal preparation because we need a minimal thickness of the porcelain, okay, and also you will need to work with this lab guy, okay, prosthetics lab guy, okay, and always they ask for see the preparations to know where they need to put the restoration, you know that. But in this moment, with all the reinforced materials, all the new materials in dentistry, okay, as IMAX does, okay, the porcelain reinforced with lithium disilicate, okay, you won't need a you won't need a horizontal preparation. You won't need 1.5 millimeters of thickness. Okay, you just need maybe 0.2 or 0.3 millimeters of thickness. So here in Europe, we had a lot of research about vertical preparations with Dr. Ignacio Loi from Italy and Dr. Carlo Pollo. So they have I think 15 years of, or maybe 20 years of research about it. The periodontal results of that kind of restorations are amazing, okay, because the fitting is very good, because the restoration is in a feather edge, you know, is just a transition between the restoration and the tooth. So we use this technique with FirstFit. I think we had around 3,000 or something like that cases around the world. 5 years of experience. We don't see any problem with this technique. I think all the dentistry will go to that kind of restoration, because you won't need a thick preparation if you have a new materials, if you have new techniques, and if you have great periodontal results.
Yeah, I mean, when we talk about this new materials as well, that the value of the color is really important as well. So when we are doing patients with laminates, they usually sometimes feel not really quite sure about the color, because we show them how it can be on this Vita or whatever brand we will use, and they are kind of saying, I'm between A1 and B1, let's say. And when we finalize it, then they say it could be quite whiter, or it could be quite darker, let's say. And in your workflow, you have to decide really precisely what it will be, and you will have to finish it without any second chances, let's say. So how are you going to get through about this challenge?
Okay, this is a good question, and I think this will get with a great experience, okay, in these 5 years, okay. We saw when you have a A3 substrate and the patient wants A1, okay, as a result, you cannot choose an A1 porcelain.
Yeah.
Because the result in that thickness will be around A2, okay? Between A3 of substrate and A1 of your restorations, maybe you mix the colors between the substrates and the restoration, and the final result will be around A2. So in our cases, we always plan with a great communications with the lab and the doctors, okay, to choose a great color, okay. If the patient wants A1, maybe we need to choose another color, okay, another option, okay, maybe BL4, okay, bleaching colors, okay. If you work with BL4 with a 0.3 millimeters of thickness, and with a high translucency porcelain, the result will be very closely to B1A1, okay? With this kind of patient with a A2 or A3 substrate, you know? Maybe the problem with that is that when you have a worst substrate, as the all the cases like the when you want when you have this kind of very dark,
Yeah, like root canal treatment made one.
maybe the root canal treatment or tetracyclines.
Yeah.
Okay, so maybe in that kind of cases, you will need to do other things. Maybe a conventional workflow, maybe, or maybe you need to mix with another treatments as widening systems in home of the patient. I don't know.
Yeah.
We need to talk with all the doctors and do a big analysis of all the cases to get a great results.
Actually, one of the most skilled technicians in Turkey, I mean, also in the world maybe, Taylan Sarı is watching, and he made a comment about the thickness. And I know he is using the Matisse program. Also, there is the eLab Prime, which I think maybe it's kind of possible when you do the prep on your software, and then make it possible to combine with the color scanned intraoral scanning and put it in this software, and it can give you the perfect recipe for your end product. Maybe I mean, it's quite not possible right now, I'm sure, but this will be quite possible in short-term future, because all the softwares are working in some other fields. Like Exocad is working on something, but you have to choose your color on some other software. I mean, if all comes around in one software, and this will be the ultimate goal for everyone, let's say, in this business.
I think that the color thing is a big problem in dentistry, okay? Because we have the light, okay, putting into the mouth, okay, but in all the cases the smile is not it's not just a smile, it's a dynamic smile, so the light comes from different ways, okay? So in some cases you will see the color like A1, and if you see the patient in another direction, maybe you will see more brightness. But if somewhere here in the world are working with this, I think it will be a revolution of aesthetics dentistry.
Definitely, I agree on it. I mean, because there's two things that we would like to change when we do aesthetic cases: the shape and the color. I mean, shape, okay, you solved everything, but about the color, we still need more automatized system which can help us during all this treatment protocol. Mr. Taylan also asked about, we need 0.3 thickness for each color changing when about the restorations. He's asking if he agrees on it or not.
I saw that paper of Christian Kochman, Marcelo Calamita, and Susana Morimoto. They say that you just need 0.3 millimeters to change the color. So it's a very hard to know all the differences between the thickness of all the cases. In some cases, you get 0.3 millimeters. In some cases, you get 0.5. In some cases, it's an additive case, okay, with 1.5 millimeters. So how the light is working in all these kind of different patients is very hard to know.
Yeah, I mean the color, how you say it's the Scrabble, let's say, like it's a game. I mean, like color is like really hard to decide and be on the same level with the patient as well. And for the technician side, I think it's the most challenging part in my perspective, let's say. So
yeah, mostly when you talk about monolithic ceramics.
Yeah, and what about the software is giving us the recipes and do the preps and do the guides for our preparation? How about navigation? Like, do you think is it possible to combine in future, maybe get rid of all these 3D printers and everything and make this possible with navigation?
Yeah, maybe it does. Maybe in the near future, this software can combine, with other techniques and machines. Okay, we are talking in this moment about maybe we need to put this software in another companies as TreeShape or Exocad, okay, to amplify the market, okay. So if you want to work with us, you just need to buy this prep module, okay, of, I don't know, Exocad maybe, okay. So you can work with this and another techniques as implants techniques, as gingivectomy surgery, I don't know, other techniques, you know.
Yeah, perfect. I would like to maybe do some last comment for all the technology itself, because I feel like this is game changing for sure, and maybe combining this all workflow with patient's face scan and then maybe some functional registration of the patient with Mojo or Zebris or whatever, it will be quite possible. It's 100% succeed will be guaranteed probably. Of course, there are some precision matters about the printers, about the preparations, about the impressions itself, but still we will be very close. A real single session dentistry, let's say.
Yeah, I think with these kind of technologies, you will increase the predictability of all your cases. So we improve the last dentistry that we have been working in last years. Okay, we improved that with these new digital techniques. Okay, I think the predictability is the best factor that you will get with digital dentistry.
Definitely.
As Invisalign does, as implant surgery does, as the milk crown at your clinic does. Okay, it's the same workflow, but in all the difference, all the specialities on dentistry.
Yeah, I mean, I feel really thankful that you accepted my invitation about this conversation about the FirstFit. What I really amazed of that the software is really nice. I mean, it's quite possible for us to think about the things that we didn't think before maybe, and now it's possible to simplify all this workflow in our daily life. And I really also thankful to see that this positioning tray maybe, because it's quite challenging to place all the laminates and not to have any problems when we are doing the cementation, and when we are doing it on the backwards, like when we place first the centrals, then the letters, and mostly on the 7th molar or 6th or the last one, there are some problems usually. That's because of the microns, which is not really placing it really high precisionly. It can comes with some problems. So that's why I will probably try the positioning tray to design it on my mesh mixer or whatever myself, and then try it. Maybe in all the conventional workflow, this is a game changer as well.
Yeah, I think this is another great feature of our technology. Okay, the positioning tray is an all-in-one technique. Okay, so you can cement all the restorations in just one movement. Okay, so you will forget the conventional workflow, cementing all the veneers one by one, trying to please don't move, please not breathe, because if you move a little bit the veneer, the other ones will be a problem. Okay, so if you get this positioning tray, you get all-in-one process, and you just need to clean very well all the excess of the cement. Okay, put a little bit the light in the middle of the veneer. Okay, and then you can remove the positioning tray to clean again with floss and saw, and then you can put all the light to final cementation. It's a crazy workflow. Okay, so in our courses, all the doctors, you need to see the faces. I think is, oh wow. I don't believe in that. So you know that.
Yeah, I can imagine this. I mean, I haven't been in one of your courses or some events, but I can believe that it's happening. So my final question about your workflow, actually, this is quite arguable, and people are discussing this topic too much. Using rubber dam in cementation protocol or not. I mean, some of them are telling that it's a necessary product to cement all these adhesive procedures, but some of them are not really fan of it. So we see both applications. In your scenario, do you think rubber dam is quite necessary, or how your doctors are usually implementing this in workflow?
I think the rubber dam is a very necessary. Okay, but we saw that maybe it depending of the case and it depending of the doctor. Okay, with FirstFit you can work with a rubber dam, but when you finish the preparations with all the guides, you will need to do the trying with the position tray without the rubber dam. Okay, to check if all the veneers are fitting in the zones, in the areas that you want. Okay, and after that, when you check that all the veneers are fitting very well, you can put the rubber dam. Okay, you can use the floss to put the rubber dam in very close to the gums, okay, and then you cement the case. Actually, we had a lot of doctors here in Madrid that worked with that workflow, okay. Other doctors prefer another ways to control the saliva and all that kind of factors, but it depends on the doctor, you know.
Yeah.
But with FirstFit, you can do that.
Perfect. I'm done with the questions actually, but for lastly, when you say you have to check if the laminates and everything is fitting quite all right, if it doesn't, what to do?
Okay, if the some veneer does not fit very well, is maybe because you will need to put the guide again and recheck the preparation. When we work with a very little bit thickness, you don't feel the preparation, you know. You put the handpiece, you do the preparation, and you will feel like a polish.
Yeah.
You know that? So in some cases, maybe some doctors will need to put the guide again, okay, and put the handpiece again to make the preparation, because they don't feel the resistance of the tissue, okay. So maybe in some cases you will need to put the handpiece again.
Perfect.
But
okay.
all the system is a chain, okay, because if the prep guides fit very well in your patients, the veneers will fit very great and perfectly, okay. So if the guide fit very well, the veneers will fit very well.
Perfect.
If the guide won't fit very well, maybe you need to stop the case, take another impression or intraoral scan, and send the case again.
Perfect. Thank you, Carlos, for attending to my channel and giving your kind words and everything. And I will be wishing you great success with your technology, your workflow, and your business as well. I'm probably would find a case with the implant and combined with everything, and hopefully we will do it. And hopefully I will be seeing you in Turkey soon about your product and everything, your workflow, that our doctors, my friends, everyone could use it more easily in Turkey as well. So thank you again for your attendance, and I would like to receive your final words, and then I will close the show.
Thank you, Dr. Sina. Thank you for inviting me. Okay, I think I will see you in the near future. Okay, I will see you in some congress in Turkey, and we'll talk more about this new technology. Actually, we are now working with other doctors from Germany, from United States, and it's very nice to see how this technology are growing up, okay, in our profession. So thank you for this invitation. Thank you for let me talk about this in your YouTube channel. Well, you have my phone number, so I will talk with you, I think, very soon.
Perfect so much. I will close the show for today, and hopefully we will see you after 2 weeks again. We will talk about artificial intelligence in radiology. Professor Kaan Orhan from Ankara University, he made a software with some engineers that to detect everything on the radiology which we do as panoramics, X-rays, the CBCT and everything. So we will talk about it on Turkish, but my Turkish friends will join this hopefully, and hopefully we will make it later on English as well. So I'm thanking Dr. Carlos again and everyone who was there to watch. And this will be staying in my YouTube channel as well, and you can check it again and share it with your friends. Carlos, please don't leave our phone call and our call. I will just finish the show and we will just have some final words.
Thank you.
And bye bye everyone.